We're switching gears now and going to discuss infection. Go back to the bone windows. So in infection, we're going to pay closer attention to a slightly different area of the spine. And that's going to be your disc and the adjacent end plate. So here's the intervertebral disc. This is the adjacent end plate. The adjacent end plate should be smooth and sharp and complete, as in this case. This is a normal end plate. When you have an infection, most spinal infections occur at the disc or the junction between the disc and the end plate. So since that's where the infection starts, that's where you'll see pathology. The bony margin of the end plate will become disrupted. You'll see areas of irregularity or erosion or destruction of the cortical end plate. And you may also see, in addition to these bone findings, some soft tissue abnormalities. So I'm going to switch to the soft tissue windows here. So again, we're looking at this disc space here. So infection at this disc can spread anteriorly or posteriorly. If it spreads anteriorly, then it will spread into the prevertebral space and cause soft tissue swelling here in the front. And if it spreads into the back, which is more worrisome, it can cause an epidural abscess or an epidural phlegmon in the back, and that can cause cord compression. Infection can also affect the paraspinal soft tissues. So here's your posterior elements, but it can also spread all the way back into the soft tissues. So if we go a little bit parasagittal here, these are all your paraspinal soft tissues on the side here, and paraspinal soft tissues here. And infection can also spread to these spaces. So that finishes up some pointers about infection. I'm going to transition now to discussion about tumor. Switch back to the bone windows. Okay. So tumor will generally involve the vertebral body. What's important to know is that if we go sort of parasagittal here, is that it also likes to involve the pedicles. So at the top here, here's the vertebral body, here's the lamina posterior elements, and here's a pedicle here, and here's a pedicle here, one more pedicle here, another pedicle here, and so forth. And they are all normal in this patient. In tumor likes to involve the vertebral bodies, but particularly likes to spread into the pedicles. So that is a key finding in tumor, is the fact that you'll see a bone lesion or destructive bone process that involves both the vertebral body and the pedicle. And if your tumor involves a pedicle, obviously you also want to make certain that you look at the neural foramina, which exist above and below it, because tumor can spread from the pedicle into the neural foramina and cause nerve root compression. We're going to switch now to the soft tissues. And just like infection at a disc can spread to the front or to the back, tumor in a vertebral body can spread also to the front or to the back. So in the front, again, you'll see a prevertebral tumor, soft tissue mass. And in the back, you can get epidural tumor, which extends posteriorly from the back of the vertebral body into the central canal and potentially causing cord compression. So that finishes a brief overview of looking at the spine for back pain. Thank you.